Hi everyone, so we're here with Dr. Laura, Healthy by Nature's new acupuncturist. Dr. Laura not only demonstrates a very strong passion for and dedication to her work, she also brings so much kindness and care to our clinic, and we're so happy to have her here. So we're going to be asking her a few questions just about her practice and her experience and what brought her to acupuncture, so we're going to dive right on into it. So Dr. Laura, could you tell us a little bit about yourself? How long have you lived in Calgary?
So I've lived in Calgary for almost 20 years now, and then I came out here to do my PhD in biochemistry, and I also did some postdoctoral research. And then I decided to retrain in Chinese medicine, and I went to school for another 4 years to get my doctorate in Chinese medicine, and also became a registered acupuncturist.
Wow, lots of school.
Yeah.
So it's clear that you have a strong passion for helping and assisting others because it's just such an integral part of your work. We're wondering what brought you to help people?
For as long as I can remember, I've always had an inherent interest in helping people, especially when they weren't well. And so I find I just kind of get in a zone when I'm treating people.
Yeah.
And I've always been interested in learning about anything related to health, whether it's in Western medicine or Eastern medicine or in up and coming new forms of treatment modalities.
Definitely. That's lovely. How has your knowledge of traditional Chinese medicine changed the way you live and approach your life, if it has at all?
It's definitely changed things. It's quite convenient to be an acupuncturist, and if you're coming down with a cold or if you hit your elbow, to just go home and poke yourself.
For sure, yeah.
So that's good. And then the other aspect is, I guess in terms of the philosophy is looking at health a different way. It's really changed things, because when you look at the old kind of classical texts in Chinese medicine, and they're thousands of years old, but they're discussing diseases and conditions that we still have today, like arthritis, diabetes, other things like anxiety, menopause, epidemics.
Definitely.
And I just marvel at that, because we're still dealing with the same issues, and they're basically possibly never going to leave us.
Yeah, totally.
But coupled with that, Chinese medicine has a large emphasis on health preservation in order to avoid those types of fates. So you have your standard issue, or not standard issue, but their perspectives on diet and lifestyle advice. So those are never going to leave us. But as well, there's two other aspects that they kind of focus on a bit more in terms of cycles in nature and kind of following what we observe in nature, and so that you can use that as a tailwind to build health, as opposed to it being an erosive factor to your health.
Definitely.
And another aspect is how important your mind is and influences your body and its health, and that's an aspect I've been getting much more interested in lately, because it's just becoming more apparent how important it is.
For sure. Wow, that's so interesting. So kind of going off of that note, what would you say is the difference between acupuncture and TCM's approach to healing and other holistic approaches to healing?
Okay. So I don't know about every holistic approach.
Totally. I don't think anyone does.
Yeah, maybe one day someone will. But the main key factor that Chinese medicine focuses on is qi, which I think most people have heard of qi now, but it's a difficult concept to define. But if you can just broadly consider it as kind of energy, information, kind of life force, that type of thing. So in Chinese medicine, they consider optimally you want your energy flowing harmoniously in your body, and they describe it as flowing along these different pathways in your body called meridians.
Okay.
So anytime someone has a health issue, whether it's like from an acute trauma or if they have anxiety or bladder condition, it's considered that the flow of qi it's aberrant at this point in one part of the body or the mind or something like that. And the idea behind acupuncture is to reestablish that harmonious flow of energy, and we do that by inserting acupuncture needles along these meridians to reestablish that flow.
So there's a very strong underlying philosophy to it, for sure.
Yeah.
Yeah, that's so interesting. So we also heard that before attending your doctorate in traditional Chinese medicine, you spent 10 years in medical lab research. What would you describe as the biggest takeaways from your time in the lab, and how would you say that was formative for your practice now?
Okay.
It's a really weighted question.
Yes. Yeah, I really enjoyed my time in research, and fluorescent proteins never get old looking at you. So that was quite interesting.
Yeah.
And but you learn what real research is, and kind of the other aspect in order to do the real research is you really develop your critical thinking skills and very disciplined kind of scientific thinking. So those aspects kind of never will leave me ever. And I still use those critical thinking skills when I treat patients. And however, every scientist that's researching their hypothesis, they really what we like to do is control all the variables, and then you do every permutation of experiments you can think of in order to demonstrate and examine your hypothesis. And with a single patient and with acupuncture, you can't do that. So that's a bit of a struggle for me.
Definitely.
Because the scientist wants to come out and improve things, but with that patient, but you can't check every possible variable with
Definitely.
the patient.
Yeah. Okay. What would you say is the most fulfilling part of your career?
I would definitely say connecting with my patients and helping them, bar none, that's the most satisfying part.
Definitely.
And I also always like learning about new health aspects, so taking courses is also fun, but definitely the people is where it's at.
Yeah, definitely. Are there areas of concern that you have a particular passion for treating, or that you have a knack for treating at all?
Recently I've become more interested in the mind, just because of it does have such a huge influence on health, but also not just the mind from a psycho-emotional aspect, but also the mind from an aspect of other conditions like PTSD or traumatic brain injuries or dementia, things like that. I find also quite interesting. So I have an orientation, I guess, towards the neurological a little bit that way.
Yeah.
But beyond that, I'm actually pretty much interested in a very broad interest. So whether it's pain or digestion or women's health, stress, those all are of interest to me as well.
Definitely. So what are some unique qualities that you would say you bring to your practice? What would you express as maybe your most notable strengths as a TCM practitioner?
That's a good question. I would say I like connecting with people. And I'm pretty open-minded, empathetic, and very adaptable. I'm always learning new things, but I also really like working on the feedback I get from patients, because not everyone's the same, and patients live in their body, so they know kind of what works best for them. So I really like individualizing treatments that way.
Yeah, for sure. I'd imagine that would make your job interesting as well, as you're trying to navigate treating all these different people and kind of meeting them where they're at.
Yeah, for sure.
Yeah. So in addition to acupuncture, do you use other TCM techniques in your practice, and what are the benefits to these techniques?
Yeah, so in addition to acupuncture, I do use a few different types of techniques, and I took some out so we can show people.
Totally.
So one of the techniques I use is called acutonics, and whenever I present this to people, I always tell them these are not children's toys, even though that's the way they look. So acutonics is a sound vibration technique, and it was invented by some American acupuncturists, but the frequencies of the forks and the application of them are based on Chinese medicine principles.
Okay.
So these are weighted tuning forks, and when you strike them, you can put them against the body, and the vibrations, because we're made of water, are able to be transmitted quite easily into the human body. So what these can be used for is things like stress, tension, pain, and also to boost energy, depending on which fork you're using. And as a patient, what you experience is typically, it feels quite comfortable when it's against the skin, and also relaxing. So, and so this looks unusual, but for some people this is really is of great assistance to them. Sound vibrations are also used in mainstream medicine as well, if one thinks of like ultrasound as a diagnostic technique. And as well as for kidney stones, sound is often used to help break them up depending on the stones. So it's just to say that this might sound weird if it's the first time you've encountered it, but it's not so strange.
Yeah, definitely.
Another technique I use is called auricular medicine. And this is based on the auricle of the ear.
Okay.
And there's nothing going inside the ear, it's just kind of more on this aspect of the surface of the ear. So in Chinese medicine, there's a number of different microsystems in Chinese medicine, and for example, the ear is one, and what a microsystem is that it's thought that you're able to treat on one part of the body, the entire body, that your body is sort of mapped on different areas of the ear, like your spine, your digestive organs, your foot, anything you can think of. So the idea behind it is that, for example, if someone comes in with a shoulder issue, of course we would treat them, but if I want to send them home with something to extend the treatment, that you would find the corresponding area on the ear that corresponds to the shoulder, and then you would put an ear seed on the ear.
Okay.
It's like a little band-aid with a seed on it.
Whoa.
So that would just be stuck on the ear at the spot where the shoulder is, and it creates acupressure on that area. So it's thought to basically kind of tell the body to reduce the pain in that area or help heal the area. So that is the use of auricular medicine, how I use it. And then I also use cupping, which I think most people have been familiar with. This is a glass cup. There's also silicone cups and plastic cups, but I think Michael Phelps made those pretty famous after that fantastic Olympics he was in. So cupping is used because it's used to help move the circulation in an area, and it basically creates a vacuum, and the skin is kind of sucked into it, and you can either move it or leave it in a certain spot, or one of my favorite things is to put an acupuncture needle and have a cup suction over it, and that kind of enhances the function of the needle.
Definitely.
So that's another aspect of Chinese medicine. And then I also offer patients, if they want, depending on their condition, I also do custom herbal formulations.
Okay.
And that would be taken orally for the patients, and that's all based specifically on what they come in for.
Yeah, for sure. Wow, that's a lot. So going off of that, what does a typical initial acupuncture appointment look like for you? So for someone that hasn't ever went in for acupuncture, what would you tell them to expect?
That's a great question. So obviously we're going to have a discussion first with the patient in terms of their main concern and the symptoms and everything associated with it and how things started.
Definitely.
And also ask other general health questions with the patient. Something that's unusual to Chinese medicine is looking at people's tongues and feeling their pulses.
Okay.
In terms of, that's part of a diagnostic aspect of Chinese medicine, so we would do that as well, and that sometimes comes as a surprise to patients. And afterwards, I basically come up with a treatment plan of what I'd like to do with the patient. And for example, if someone comes in with pain, also during the appointment, before I put needles in, I usually do acupressure on them on different acupuncture points, just to see which ones are going to yield the best result for the patient, as opposed to, so we can use the least amount of needles as possible.
Definitely.
And then we always do acupuncture during the treatment for sure, but depending on which other modality or treatment type they might need, then I'll incorporate that as needed. And then especially for acupuncture, I just kind of talk them through, make sure they're always comfortable, and that's kind of the way things go.
Yeah, for sure. That sounds great. Kind of on the same wavelength, I guess, what information would you offer to someone who would like to try acupuncture but is a little bit worried about the needles?
Yeah, that's a great question. So what I would say is that needles that we typically get from like a blood draw are much larger, and obviously they need than what. Don't associate that with an acupuncture needle, because they're much finer. They're going in generally pretty shallowly, and for most people, like, they don't really feel them, especially on certain parts of your body like your back. You might not even notice that they're in. It's actually kind of interesting that way. And so there's no you're able to relax with them in. I never thought that that would be possible myself, but you're able to relax with them in and just be chill. And if it is someone's first time, I'm always checking with them in terms of making sure they're comfortable, and most people are typically surprised by how little discomfort they use or perceive. And as well, some individuals, for a technique called intramuscular stimulation, or it's also called dry needling. So that's, I guess I would consider it a little bit more of an aggressive needling technique, and it works wonders for some people, but other people might have had an experience that they weren't the happiest with. I don't personally do that type of needling. It just doesn't fall into the style of things that I do. So I would say that to someone that has had that type of style, that I don't do it, so they don't have to really be concerned about that. And I'm pretty gentle. So, and I'm always making sure the person is comfortable, so, and we can take it slow.
For sure. Yeah. Okay, that's perfect. Do you have a few notable success stories that you would like to share, and what makes these stories significant to you?
I can think of one that when I was in acupuncture school, one of the outreach clinics we worked at, just one day a patient came in that had had a stroke a number of years prior, and they still had speaking difficulty, which is called aphasia. And so I was treating him that day, and I just did some points, and then he came back the following week, and I had to, and he just his being just seemed so different. Like, he just seemed so much, relatively speaking, like more clear-headed. He could speak better, and he just looked just very different. And I had to look at the other people that were there the week prior, because they're just, as a doubting scientist, I was like, oh my god. And then other people saw it like as well, like it was very obvious, and I was just in awe after that. And I continued treating him for about a year, and like dexterity and his speech improved, and like, I'm not saying he got back to prior stroke levels, but the improvements were very remarkable. And I'll never forget that, and we formed a good bond too, so it was, that's
amazing. I'd imagine that would be such a great experience, especially when you're like kind of just starting out your career as well, just seeing that like what you're investing in is actually something that really benefits other people. Where would we find you outside of the clinic? Do you have any hobbies that you pursue in your spare time? Any other interests?
So yes, of course, I'm a human being.
So, exactly. So what kind of question is that?
Well, exactly. Yes, I breathe. So recently I've been quite interested in Qigong, which is a type of practice that involves postures and movements to kind of build your body's qi, and I found that quite interesting. But beyond that, I obviously like learning about health. What can I say? But I enjoy reading, like walking and hiking. I used to do martial arts and kickboxing things, so I would like to get back to some of that, because that's just inside me as well. And but I like taking it easy.
That's always a good thing to do, honestly. Okay, so our last question is, so you recently completed some training for acupuncture for women before, during, and after pregnancy. Can you tell us a little bit more about the service and how it works, or what it looks like a little bit?
Absolutely. So that was an interesting course. I learned a lot, and pregnancy is a pretty interesting time for the body. So there's different things that stood out for me. For example, like how to optimize women for like a good birth, basically by coming in a few weeks prior, about a month before you're due that you start coming in for treatments, and it helps kind of ripen the cervix and get everything ready so that when your hormones do start building with the oxytocin and those sorts of things, to start that you'll have an efficient birth. And I found that quite interesting.
Definitely.
So that was cool. And then there's other conditions that we can help with, like varicosities in the body that develop during pregnancy, also heartburn, and headaches, things that basically there's no other option for women, the treatment modalities for that, and I found that pretty fascinating. And that's all I can remember off the top of my head right
Honestly,
now.
I think that's a lot.
Also helping manage gestational diabetes, and kind of increased blood pressure during pregnancy. Again, these are conditions that should always be followed with your physician or OB/GYN or midwife.
Definitely.
It's not something you should only consider acupuncture as the sole treatment modality. You should definitely always be, it's good to work with those professions in concert.
Yeah,
basically.
just like definitely helps along with the journey for sure.
Yeah, everything for the baby and the mother.
Oh, exactly. Well, that is all the questions that we have for today. So thank you so much for sitting down and answering all of our questions and telling us a little bit more about yourself. We're looking forward to having you around the clinic.
Oh, thank you, Heather. It's a pleasure.
Hey, no problem.
Nice
Bye.
meeting you.